the first time in Southwest Louisiana, neurosurgeons have successfully removed a brain tumor from a patient during an awake craniotomy procedure. KPLC's Brittany Glazer talks to the woman brave enough to be awake as her brain was operated on, and to one of the surgeons behind this incredible milestone.
Scary symptoms brought Dale Lutgring to her doctor in May.
It started with my left eye twitching, and then my mouth started twitching.
An MRI showed that Dale had a grade 3 glioma, a brain tumor that Christus St. Patrick Hospital neurosurgeon Brian Kelly says requires a craniotomy to remove.
Remove the skin in a flap-like fashion, preserving the vascular structures, and then be able to form a cookie cutter piece of the bone with various drills to be able to remove the bone and open the linings of the brain to be able to access the brain proper.
Since Dale's hand and face were being affected by the tumor, Dr. Kelly knew it was in a very sensitive area of the brain.
If you have a tumor that is infiltrating this region, it is going to put them at a high risk for permanent and fairly substantial and life-limiting neurological deficits.
Dr. Kelly told Dale that an awake craniotomy would be the best procedure to protect the parts of her brain controlling movement. But the idea of being alert with an open head was definitely not easy to stomach.
As he was removing the tumor, he could see if things were happening that he needed to back off. And it was very scary. The morning of surgery, I really was thinking, I don't want to do this.
But wanting to have the tumor removed, Dale agreed that an awake craniotomy was her best option to preserve brain function.
This is where we are actually able to see within a millimeter's distance where we are in the brain at all times.
3D MRI images and navigation software mapped out the exact spot of the tumor and the region of Dale's brain controlling her movements. Local anesthesia numbed the pain.
The brain actually has no sensation. So the only thing that actually hurts is the skin. The bone doesn't hurt and the brain doesn't hurt.
Dale was sedated as her skull was opened and then brought to consciousness.
I remember them saying, "Wake up, Dale, it's time to wake up." And I remember being told things like frown, smile, squeeze my hand.
We're able to provide a low current to an area, and you can actually see the hand tonically contract or the face smile. And that is a good indication for us as we move around the site for the tumor that we are able to tell exactly where it is that we should not go.
Dale's tumor was completely removed. Then she was lightly sedated again as her skull was closed. In the weeks following her surgery, she has shown no signs of function loss and says it's her fighting spirit that brought her through.
And my thought was, I was going to fight this. I'm not going to let it defeat me. I'm going to defeat it.
At your service with Healthcast, Brittany Glazer, KPLC 7 News.
Dr. Eric Wolf was also on this neurosurgery team for the awake craniotomy. Trauma patients and those with brain tumors are the best candidates for this delicate surgery.